Hello, it's Jess Hoy, and this is chapter 2 of asthma. So I'm going to get right into the meat and potatoes of things and share my screen. There you go. And so where we left off in the last chapter was assessment and diagnostic. So our goal is to achieve and maintain control of the disease. Like that is the overarching asthma goal. Achieve and maintain control. So we're going to start with prevention, right? Because in this particular population, an ounce of prevention can be worth like 10 pounds of cure for these clients. So what will happen when they're not having an asthma crisis, an asthma attack, or even worse, a status asthmaticus attack, which that's another chapter. Testing is going to be helping us determine the causative agent. So if we can determine what is causing things, we can hopefully help them avoid things. Pollen, dust mites, roaches and roach droppings, but they can definitely be triggers. Clothing, pets, horses, detergents, soaps, certain foods, and especially molds can help people too. So if you think of people who are maybe living in a lower income neighborhood, they may have mold in their environment and not be able to afford to live anywhere else. They may have roaches in neighboring units from theirs. Like they may be incredibly clean people, but you can only help out so much for your own individual if you're living in a multi-unit facility, which those of you who have smelled anybody who has burnt popcorn or some sort of food in their own living space and that smell has traveled to your living space know exactly what I'm talking about. About 15% of new asthma cases are caused by workplace. So detailed work history is really important. And removing or decreasing the exposure is the immediate treatment. And then we're going to follow with asthma medications. Speaking of asthma medications, there's two classes. There are bronchodilators and there are anti-inflammatory medications. And these are listed in detail on pages 551 and 552. We can use these drug classes alone, or we can use them in combination with one another. So bronchodilators are going to be relaxing those smooth muscle bands, back to A and P, those smooth muscle bands that are in our airways. So bronchodilators relax those by binding to the beta-2 receptors. Anti-inflammatories are going to be decreasing the inflammation response of the tissues in the airway. So they work together in a little bit different ways. So the anti-inflammatories are going to take the inflammation out of the tissues that are lining the bronchus and bronchioles. And then the bronchodilators are going to relax those muscles. Then we're also going to be doing some management of the exacerbations. So early treatment is about patient education. It's about getting the right meds at the right time, making sure they know whether they're taking a daily medication, what their rescue inhaler is for. And then also we're doing some written plans to aid in self-management. And I think all of us have gone into some sort of crisis mode at some point in times in our lives. It's hard for us to like bring everything that we need to know out into our front of our brains and be really prepared and cognizant about things. So written tools and plans are really important. A person who's having an asthma attack or those caring for them might not be able to recall that plan from memory because the situation is so intense. So having something written out as a checklist literally can be a lifesaver for these people. And we want to make sure that they understand these education tools and include leveling of the patient's education and appropriate treatments. So here is an asthma treatment plan or an asthma action plan. It's a little bit It's a little bit old from 2007. However, it's still completely appropriate. These are from the National Institutes of Health. So are you doing well? We're in the green zone. If you're not doing well, your asthma is getting worse, we're in the yellow zone. And then if we're in the red zone, then we have a medical alert. So part of this asthma action plan is, how is your peak expiratory flow rate going? How is your PEFR? It's a very concrete way, it's a numbers value way that we can evaluate what is going on with that asthmatic patient. So here is an example of a person using peak expiratory flow monitoring. It measures the highest volume of airflow during a forced expiration. The patient takes a deep breath and then puts their lips around the mouthpiece and then exhales hard and fast. So they have zones, just like as we saw on this particular slide. There are zones, right? Green, yellow, red. So the green zone signifies 80 to 100% of their personal best. These plans are personalized to people. A 7-year-old's thumbs will not be the same as a 17-year-old's, a 27-year-old's, or a 70-year-old's. So we have the green zone, the yellow zone, and the red zone specifically set up for each asthmatic or person with asthma as green are in those color-coded zones. If the peak flow falls within the red zone, you need to take appropriate actions as prescribed by his or her primary provider. And that may include coming in, that may include a variety of other interventions. But that's all laid out in their plan. They don't have to try and remember what's going on. As far as nursing management, we are going to be obtaining a history of allergic reactions to medications before administering them. Before administering medications, we are going to be taking a history of allergic reactions. We're going to be looking at their current meds. We're going to be administering meds as prescribed and the patient's response to that med. We're administering fluids if they're dehydrated. People who are working on breathing do not like to drink and they do not like to eat because they're trying to get air in and out of that common nasopharyngeal area, and that the body overrides that sort of things. It's easy for them to get dehydrated. And we're going to be doing frequent assessing of vital signs and focused assessments. For patient education, we are going to be emphasizing self-care for these people. The nature of asthma as a chronic inflammatory disease. This is not a one and done situation. Definitions of inflammation and bronchoconstriction, so they can have a really good understanding about what's going on in their body when they're having these problems. There's the purpose and the action of every medication. Triggers, how to avoid them. Proper inhaler technique, that's kind of a thing. If they're not using their inhaler the right way, they're not going to be getting the full benefit of the medication. And how to perform peak flow monitoring successfully. As we go into continuing care, as for our end as nurses, we are assessing the patient's respiratory status, their ability to manage self-care. How often are they coming into urgent care or the ED because their current management plan isn't working for them? Is it not working for them because it's inappropriate, like the plan is inappropriate? Or is it not working for them because they don't know how to work the plan right? We need to emphasize adherence to the therapy and preventative measures, and the need to keep follow-up appointments. We also may need to do some home visits in order to determine what the cause is for those recurrent exacerbations of a person who's coming in and giving us some signals that they're not necessarily doing their self-care management appropriately. I'm going to stop sharing. This is the end of the asthma portion. The asthma portion has 2 chapters. I am putting a status asthmaticus presentation together next. That will be its own little standalone chapter, but if you're going through the PowerPoint, it's included in the PowerPoint. We will see you again in class, or I will see you again for status asthmaticus.